In the dynamic world of healthcare, a new challenge emerges in the United Kingdom. As we navigate the turbulent seas of the healthcare sector, a storm is brewing that threatens to disrupt the calm. The United Kingdom finds itself in the eye of a potential crisis, a critical shortage of medicine. The cause? The European Union's strategic moves to attract drug makers to its shores. This isn't just a business story. It's a story that could affect every man, woman, and child in the UK. It's about the pills that control our blood pressure, the antibiotics that fight our infections, and the vaccines that protect our children. It's about our ability to take care of ourselves and our loved ones when they're most vulnerable. This isn't a distant problem, a crisis to be shelved for another day. It's a looming threat that could strike at the heart of the UK's healthcare system. Imagine a world where your local pharmacy can't fill your prescription, where hospitals struggle to provide basic treatments, where the medicine cabinet is bare. This could be the reality for the United Kingdom if the EU continues to lure away drug makers. The potential fallout goes beyond healthcare. It could ripple through the economy, affecting jobs and livelihoods. It could strain the relationships between the UK and its European neighbours and spark a political firestorm. And at the centre of it all are the people, the patients who rely on these medicines to live, to thrive, to survive. This isn't just a crisis. It's a test of resilience, of adaptability, of unity. It's a call to action for the UK's leaders, its healthcare professionals, and its citizens. It's a chance to prove that when it comes to health, the United Kingdom won't be swayed by business moves, won't be left in the dust, won't be silenced. This could mark a significant turning point in the UK's healthcare landscape. The question is, which way will the winds blow? Will they usher in a storm of shortages and strife, or will they clear the path for innovation, resilience and unity? Only time will tell. But one thing is clear, in the dynamic world of healthcare, the UK must be ready to face any challenge that comes its way. What role does the European Union play in this imminent crisis, you may ask? Well, brace yourself for a bit of a whirlwind tour. You see, the EU has been playing a rather strategic game, enticing drug makers with a host of incentives that are hard to resist. These incentives range from favourable regulatory conditions to attractive tax incentives. The idea is simple: lure drug makers to set up shop within their borders, thereby strengthening the EU's own pharmaceutical industry. This strategy, while advantageous for the EU, has an unintended consequence. It's contributing to a potential medicine shortage in the UK. The EU's attractive incentives are drawing drug makers away from the UK, leaving the UK's pharmaceutical industry in a precarious position. But why is the EU doing this, you might wonder? The reasons are manifold. Firstly, it's about self-preservation. The EU wants to ensure it has a robust pharmaceutical industry that can meet the needs of its citizens. Secondly, it's about economics. A thriving pharmaceutical industry can spur economic growth, create jobs, and increase the EU's global competitiveness. But there's a third, more subtle reason. The EU is keen to position itself as a leader in the global healthcare industry. By attracting top drug makers, it can foster innovation, drive research and development, and potentially lead the way in new drug discoveries. However, these actions have far-reaching implications. The EU's strategy could reshape the pharmaceutical industry in ways we've yet to fully understand. It's not just the UK that could feel the effects. Other countries, particularly those outside the EU, could also find themselves grappling with similar challenges. Even within the EU, the impact could be significant. While the influx of drug makers could boost the industry, it could also lead to increased competition and potential market saturation. And let's not forget the potential for increased drug prices as companies seek to recoup their investments. The EU's actions could reshape the pharmaceutical industry, affecting not just the UK, but also the rest of Europe. This is a complex and evolving situation, and one we'll continue to watch closely. The stakes are high, and the outcome could have a profound impact on healthcare as we know it. With the threat of a medicine shortage looming, what lies ahead for the UK? As the sands of time slip away, potential measures loom large on the horizon. The UK could consider bolstering domestic pharmaceutical production, reducing reliance on imports. Or they might negotiate new trade agreements, fostering stronger ties with global partners and ensuring a steady flow of medicines. The importance of swift, decisive action cannot be overstated. The UK stands at a crossroads, with the health and well-being of its citizens hanging in the balance. Proactive measures could prevent a healthcare crisis, preserving the stability of the nation's health system. In the face of adversity, the UK has the opportunity to innovate, to adapt, and to grow stronger. The decisions made now will echo into the future, shaping the landscape of healthcare for generations. This isn't just about averting a temporary crisis, it's about defining the future of healthcare in the UK. The UK's response to this challenge could define its healthcare future. As the world watches the unfolding events, it's crucial to stay informed. We live in a global community, where healthcare crises in one corner of the world can ripple out and impact us all, directly or indirectly. Knowledge is our greatest weapon in these uncertain times. It allows us to understand the issues, to engage in meaningful conversations, and to advocate for change when needed. This is not just about the UK or the EU. This is about all of us, about our shared humanity and our shared responsibility. It's about understanding that our health, our well-being, are intertwined with the health and well-being of people across the globe. Being informed is not a passive act. It's an active choice, a commitment to understanding the world around us and our place within it. It's about choosing to engage, to listen, to learn. So, let's not just watch the world unfold around us. Let's be a part of it. Let's be informed, engaged, and ready to make a difference. To stay updated on this and other crucial healthcare topics, subscribe to our channel, your source of reliable health news.